So as we continue to go through historical methodologies and display them and discuss them in terms where we're able to take the concepts on so you can understand it, this is a description, as you've noted from the slide before. Remember, pause to read it because it won't be up there for too long. But essentially, Dr. Still is speaking about treatment for diarrhea. But in his treatment for diarrhea, you're going to essentially get treatment for the lumbar column and the thoracic column. The treatment for the lumbar column, he talks about doing this against a door jamb. Now, for practical purposes and for framing a shot, I'm not going to do it against the door jamb, but the idea is relational motion. So in relationship, you're going to make the sacrum still, and you're going to move the lumbar column. Your handle is going to be the shoulders of the patient. So you basically, he says to put their chest against the door jamb, so you'd have them lean forwards. He doesn't say specifically the relationship of their abdomen to the door frame, but you probably have it a little bit further back. But basically what it ends up looking like is you put your knee on their sacrum, so that's the relative still point, and then you're going to do this, right? You're going to pull them back, create extension, side bend them, twist them, as would be needed. The challenge with that, in practical terms, is you won't necessarily be able to palpate it, so you're just trusting that your read of motion, pre and post, is going to be as accurate as possible. The next step that he says is he puts them against the door jamb with their back against the door jamb. The reason it's a door jamb and you wouldn't do it like this is because you want space for the scapula to slide behind, but it's essentially coming in here, spreading the scapula. And the next step, we'll have you sit facing towards me, is he says have the patient put their arms over your shoulders. You don't have to do that. Essentially what you can do is have them fold their arms and come up. So basically what you're doing is trying to create shoulder extension to create vertebral extension, as well as grab some tension from muscles that go from the arm to the ribs. So primarily serratus, but a few others, maybe a little bit of lat to help you with this, but we'll have you go like this, right? So then you reach under, you place their forearms on your clavicles, and you're here. So he's talking about ribs. So my hand like this, contact is control, so lots of contact, right? Broad contact for multi-point discrimination, so I can palpate through the ribs just by doing different things with my hands, right? And then I create motion of the ribs as is necessary. So varying motions, right, to work on the restrictions as found, right? And he does talk about doing this with the vertebral column. I will say that this is not particularly useful in the way that you would think it is for the thoracic vertebral column, because I cannot get appropriate thoracic extension as that would be required. I can check multiplanar motion though and work on the restricted area. So basically you just use a large motion, so macro identifies micro, to identify the smaller area of problem. Now in this case I can't see it, but I can, if I use broad contact for multi-point discrimination, I can feel the area of restriction and address it as is required. These descriptions begin from Dr. Still speaking about treating diarrhea. I would not suggest in any way, shape, or form that this is a treatment for diarrhea, but what I would say is that you can extract the concepts for the methods that he's used. So relational motion, keeping the sacrum still, moving the lumbar column in relation to it. You can do that in multiple positions. You can keep the pelvis still and move the lumbar column in lateral. You can do it in prone. You can do it in supine. It's a little bit easier to do in prone than in supine, but you can do those things. As far as the thoracic region, you're relatively, in a very relative sense, keeping the shoulder still or the arm still, and then you're moving in relation to the patient, which will then move the thoracic region in relation to the relatively still arms. And then as you palpate through, broad contact for multi-point discrimination, you'll identify the restriction and work there as is required.